The third session was the third group looked at the business case for investing in health-promoting urban environments and the link to sustainable development goals. And Chris Dye is going to give this one. Thank you.
Thanks very much, Mary, and thanks to everybody who contributed in our group discussion. We were 16. We didn't run out of things to talk about either in an hour and a half. We didn't necessarily agree on everything, but we were rather polite in our disagreements with each other. I will, however, try to give you an aligned view as much as I can. I didn't get to PowerPoint slides, but you see some notes in Word in front of you, which will serve as an aide-memoire for me at least. So as Mary said, we were discussing the business case for investing in health-promoting environments and exploring also the links to the Sustainable Development Goals. What we agreed very quickly at the beginning is that the business case is not limited to what the private sector might do in developing a business case, but rather it's much broader than that. It's the private sector and it's the public sector, and the business case is simply a formal way of defining how we would evaluate returns on investment in investing in urban health. What we also agreed very quickly is that the idea of return on investment must be very broadly conceived. So we're not simply talking about money in and money out. We're talking on the investment side or the input side about, besides financial investments, social and political investments. And we considered briefly how we would characterize those. We didn't come to an answer, but we agreed that they need to be in the mix, even if they couldn't be precisely quantified. And on the output side, we're not talking only about health or even about well-being, which is a broader framing of health, but we recognize that other people who will collaborate in developing the business case have other priorities, such as peace, security, employment, education, and that's only a very partial list. And so when we're developing this business case, we're working with many different kinds of stakeholders. But just before I come to the stakeholders, we did have a sub-discussion on the economics, and everybody recognized that even if we are talking specifically about money, we need to do so in a comprehensive way. In other words, we're not simply talking about financial payments and financial returns. We're talking about making a full economic case such that when you invest in health, you recognize that people not only get healthier, but they're also eligible for employment. They are more capable of work. They are better able to participate in education if they're children, and so on. So even when we boil this down to money, we need to make a comprehensive economic analysis as part of the business case, as part of evaluating the returns on investment. Now, point two, if you want to go down the screen a little bit to expose it a bit more, is a consideration of who the players are. We asked the question, who is the business case being developed by, and who is it being developed for? Who is the audience for what we're trying to do here? We strongly emphasized, although there were differences of opinion about this, we strongly emphasized that the community is absolutely key. In other words, those whose health we are talking about must have an active stake in developing the business case. We are not doing things to them or simply for them. We are doing things with their full participation. And the case was made that they should be very strong participants, even to the extent that they have a veto, potentially, on proposed investments, whether they come from the private sector or from the public sector. But those other sectors, those other segments of society who will be involved would include, of course, the government, very often non-governmental organizations, including faith-based organizations, though we didn't talk about those, but they're potentially important actors. Investors, large and small. The large investors are sometimes obvious, but a number of people made the important point about local entrepreneurship that is often seen in informal settlements and in slums or even in small towns. Those local entrepreneurs that are making their business only on a small scale are important contributors to, potentially, to the development of health. And of course, we reminded ourselves not to leave out the academic community, which has an important role in the research component of this. If we're developing a business case, how do we define what actually works, even in one setting, and how do we know whether what works can be generalized to other settings beyond the communities we're working in? And the research design expertise of the academic community and their expertise in evaluation is critically important. Thirdly, we asked, how can the Sustainable Development Goals make a contribution to developing the business case for considering returns on investment? The discussion on this point focused mainly on the role of intersectoral action, and several people made the point in several different ways, but we really converged on the same thing. An important step in making plain the possible interactions in the SDGs. For example, health is number 3, but poverty is number 1, food or hunger is number 2, education is number 4, water and sanitation 6, and of course cities and infrastructure that we've been talking about is SDG 11. So what the SDG framework does is it lays out in front of you the potential interactions and the possibilities for bringing other players into developing the business case, which was the focus of our discussion. We also recognize that, of course, the Sustainable Development Goals are about sustainability. But a point that we didn't discuss in depth, but which is a sticking point for me, is that the word sustainability on its own is not going to be strong enough to make a case for long-term investment. So we may argue that the Sustainable Development Goals call for long-term investment in health, but I think we need to make that case more carefully and more persuasively. In other words, we can't just state that it should be so. We need good reasons for making it so. And in this part of the conversation, talking about multisectoral action, we recognized again that health is only a small part of one equation among multiple equations, and that although we're concerned with health, health may often play a minor role, certainly not the dominant role, in who wants to spend money on investing in urban development. So health is only a small part of that. Fourthly, we considered what is distinct about discussing urban environments as opposed to any other kind of environments. Well, rural would be the natural point of comparison. And there were 5 points that emerged from this section. First of all, the obvious one that most people live in urban areas, and I think by 2050 the projection is that 2/3 of people in the world will live in urban areas. So clearly we're dealing with the majority of the world's population. And in dealing with the majority of the world's population, those people who are living in towns and cities are going to influence what happens in whole nations, not just in the urban areas of nations. They tend to be economically highly active and entrepreneurial communities, and indeed that's part of the reason why people migrate to cities in the first place. They live at high density, relatively high density, which has implications for how we provide services and infrastructure. So a business case might therefore have special features in an urban environment that simply wouldn't apply elsewhere, for example, in a less densely populated rural environment. Urban environments are characterized by rapid change, which is a potential benefit, but it may also be a significant challenge keeping up with the pace of change. And one thing I added that we didn't talk about, but I think I should mention anyway, is that often urban settings tend to be more unequal. Now that's come out in conversations in the rest of this workshop, but we didn't dwell on it in our discussions in this breakout group. The 5th area of conversation was around case studies and data, and both of the reports from groups 1 and 2 have stressed this point as well, so I think we are very much on common ground here. What we need, we talked about a few case studies. We talked a lot about Haiti, for example. We explored Haiti, but we also recognized that Haiti is a somewhat unusual case. In fact, in a number of ways, we hope it's an unusual case because many of the things some of the things that have been done with respect to urban development and health in urban development in Haiti have not necessarily been successful, at least not yet. So we concluded from that we need a broad range of case studies. We need empirical evidence on which we can establish a set of best practices. When I spoke yesterday morning, I referred to UN Habitat's database of about 5,000 case studies on developments in the urban environment, which is clearly a valuable resource. Now, their emphasis is not particularly health, but the same sort of body of case studies would be enormously helpful when we think about what evidence we can draw on in order to make the business case for investing in urban health as part of development. A couple of final thoughts. Number 6, perhaps on the less positive side and one on the more positive side. On the less positive side, the discussions we had around multi-sectoral action, stimulated very much by the SDGs. We recognise that there is enormous potential in bringing people together. Shared finance is what I mentioned here, but many other advantages as well, combinations of expertise and so on, working across disciplines. But there are potentially very big challenges as well. And in my own observations, separate from discussions in this meeting, I've often seen that intersectoral action or multisectoral action is commonly discussed, but the health outcomes that we see resulting from that are often hard to discern. In other words, some of them are discussed and some of them don't work. Again, this is an area where we need a better evidence base on what does and doesn't work in multisectoral action. So that's the slightly less negative point. But what I thought was stimulating about the discussion we had in this breakout group and also the rest of the discussion this morning and yesterday is that in thinking through these problems, there are potentially whole new ways of going about development. So that development is not just an ecological succession was one of the terms we heard yesterday, assuming that what we're going to see in lower income countries now is a path that follows what we've seen already in higher income, middle income countries and rich countries. In other words, they need not follow a separate path. And by exploring some of the ideas that we've discussed in this workshop, the opening up of completely new paths for development and completely new opportunities for development, I think is potentially enormously exciting. And if we can capture that, some of that from this workshop, I think that will be an enormous step forward. So thanks again to everyone who participated in our group. And like the others, I ask those who are in the room to add, subtract, modify, or as they wish. And I see Peter immediately would like to do that.
Yeah, well, I thought you did a fantastic job moderating and summing it up really nicely. And, you know, I think one of the things that was exciting for me was this idea of connectivity, that urban centres, especially slums within urban centres, are so connected to the neighbourhood just outside the slums. So we have the rich and often the decision makers living in close proximity to the disenfranchised and poor. And health connects them, the disease that spread, the mosquitoes that fly, and creates a perfect opportunity to get a business case that will actually make sense to an often politician or a decision maker who's not well connected to the slum. And I thought we heard a little bit from the talks today about the pitch point for the business case around the people in the slums are generating GDP for the country, so it's a macroeconomic benefit. The people in the slums are workers who clean your room, who make your food for the decision makers. So there's an incredible connectivity that often isn't thought about, and I think that as well as the business case, there's a pitch there that could really get to those decision makers.